Good day everyone, I am Ivan Clarence Mendaros, a student nurse from Davao Doctors College. For today's video, I will be performing a return demonstration and assessment of the skin, hair, and nails. So prior to performing this procedure, we have to perform proper hand hygiene and don our PPE if necessary. After that, we can now proceed to the assessment. Okay, these are the equipment that we need to use during the assessment. First, gloves. Gloves help keep your hands clean and lessen your chance of getting germs that can make you sick. Second, the ruler. It is used to make measurement when a patient has any lesions to his or her body. Third, pen light. It is used to clearly see the freckles, moles, or anything we need to see in the patient. So after that, we can move to the assessment. Good morning, ma'am. Before anything else, I'd like to introduce you to myself. I'm Ivan Clarence Mendaros, your student nurse today. Before getting any further, I'd like to let you know that I am asking more information, particularly about your health and medical backgrounds in some personal circumstances. Should that be alright to you, ma'am?
Yes.
Okay. And your answers will be documented, but you don't have to worry because the information I get from you will be in private and medical purposes only. Do you have any questions, ma'am?
No.
So, okay, let's start. What is your name, ma'am?
Kaiza May Alcantara.
Kaiza May. Your age, ma'am?
19.
Your address?
Bawa Street, Tigo City.
Your religion?
Catholic.
Your status?
Single.
Okay. The purpose of getting biographic data so that we can provide accurate identification of our patient. For the next part of the interview is about of your health history. The purpose of this is to gather subjective data. What brings you here, ma'am?
I have itchiness and redness in my arm because I bought fake lotion in online.
Okay. Do you have okay, how long have you experienced this, ma'am?
2 days ago.
2 days ago. Do you have any allergies, ma'am?
No.
Family background, ma'am. Does any of your family member that has experienced like skin cancer?
No.
Okay, let's start our assessment. If there are any curtains or any doors in the room, we have to close them in order to provide privacy. After that, we have to explain the procedure to the patient. Miss Kaiza, I am here to perform an assessment on your skin, hair, and nails. We do this to ensure that everything is normal and if there are any abnormalities in your skin like discoloration or skin lesion, in order to prevent any further complications, so you do complications. So do you have any questions? Okay. After that, we want to remove the clothes of our client and put the examination gown on them. We have to remember to expose only the parts that we are going to examine and cover the rest of the parts that we are not going to examine. The patient will remain seated most of the examination, but will need to stand during the examinations. And now we start the inspection. First, we need to inspect the overall skin coloration of our client. We are trying to look for any signs of pillar, cyanosis, jaundice, and everything that look discoloration of the skin because that may indicate abnormalities on the skin. May I invite you to raise your arms like this, ma'am? But what I am seeing now is that the skin color of my client is indicating redness because of itching. The next thing that we want to inspect is for the skin lesions. We are trying to see for any signs of bruises and any signs of wounds or insect bites or scratches, any signs of lesions, because we want to know that, because that means that there are abnormalities on the skin. May wait. May isa hanagay mo. As I am inspecting the skin of my client, there are some scratches on the skin of my client. After we inspect the skin for any discoloration or lesions, we can now proceed the next part of the assessment, which is palpation. The first thing that we want to assess is the temperature of our client using the back of our hands, because this is more sensitive to temperature than our palms and fingers, since it has thicker skin and blood circulation. We are trying to feel any signs of fever or shock, any signs of infections. I'm going to put my hands on you, ma'am. Is that okay to you, ma'am?
Yes.
Okay. But it's look like my client has normal temperature. If we are going to assess the open skin area, you have to put or don gloves. The next thing we want to palpate or if for the texture and moisture of the skin. For assessing the texture and also the skin turgor of the client, we want to expose the part of the skin just below the clavicle of our client. In assessing the skin turgor, we want to pinch the skin below the clavicle of our client. If the skin returns immediately to normal, that means that there is an absence of skin turgor. But if the skin stays pinched, that means there is a presence of skin turgor. In the presence of skin turgor, it indicates dehydration. Can you? As I inspecting my client, she does not have any presence of skin turgor. Lastly, in assessing the skin, we want to palpate for edema. In assessing for edema, we want to apply pressure on the skin. If the skin becomes indicate, it means there is a sign of edema. But if the skin quickly return, there is no signs of edema. Can you please your So my client doesn't have any signs of edema, so that is good. So Miss Kaiza, now I'm going to assess your nails. Do you have any questions before we proceed?
No.
Okay. We want to see or look here in the nails. We want to know the shape, the color, and the texture of the nails, and see if there are any presence of clubbing or blue slimes on the nails. Can you please raise your hand like this, ma'am? Okay. So as I am inspecting, the nails of my client are normal and there is no signs of abnormalities. So the next thing we want to assess here is the capillary refill of the nails of our client. In doing that, we should apply pressure on the nails of our client. If the color quickly returns to normal, that means the nails has a fast refill, it means that is normal. And if it does not quickly return to normal, it means that it has slow refill on the capillary, is a sign of respiratory or cardiovascular disease that may eventually lead to hypoxia. Okay, can I raise your hand again, ma'am? Okay. The next thing that we want to assess is the hair in scalp or of our client. In doing that, we want to don our gloves. We are trying to see for any signs of lesion or any signs of infestation in the skull in the hair of our client. If there is any flaking in the skull, if there is any lice on the hair, we want to take note that as well. Okay, take care. As I am inspecting the hair of my client, it seems that her hair and skull is normal, so that's good. That's good. So after that, we want to remove our gloves and we want to remove the PPE also. Can I remove this now? So now I am going to review the patient's data. So ma'am, my findings are your hair and scalp are normal, but your skin turned to red because of your scratching. But don't worry ma'am, I am going to refer you to another health practitioner for further evaluation. So do you have any clarification ma'am before we end?
No.
Okay. Thank you ma'am. So that's all. Thank you.